If you're waking up 2, 3, maybe even 5 times every single night just to use the bathroom, I need you to hear this carefully, because what I'm about to tell you may completely change the way you think about water. Most people assume nighttime urination is simply part of getting older. They think, well, I'm over 60 now. Of course I wake up at night. But what most people don't realize is that the way you drink water during the day may be silently training your bladder to wake you up all night long. And this is where things become dangerous. Because poor sleep after 60 is not just frustrating, it affects your memory, your heart, your blood pressure, your balance, your immune system, even your risk of falling. I've seen patients who thought their only problem was a small bladder. But the real issue was the timing of their water intake, not the amount, the timing. One patient told me something I'll never forget. She said, "Dr. Caldwell, I'm more tired when I wake up than when I went to bed." And honestly, that broke my heart, because chronic sleep interruption changes people. It drains joy out of daily life. It makes mornings harder, walking harder, thinking harder, and after enough broken nights, the body begins aging faster. But here's the good news. For many older adults, this problem can improve dramatically without medication, without surgery, without expensive treatments. Sometimes, the solution starts with understanding how your kidneys and bladder actually work after age 60. I'm Dr. Caldwell, and today I'm going to walk you through the real science of hydration and nighttime urination in older adults. But I'm going to explain it simply, clearly, like we're sitting together in a quiet office conversation. And later in this video, I'm going to share the single most overlooked nighttime urination trigger I see in older adults. Almost nobody talks about it. But once you understand it, everything starts making sense. Before we go further, I want you to leave a quick comment below. How many times do you wake up at night to use the bathroom? 1, 2, 3, more? And if you're over 70, tell me that too. I read these comments carefully, and you'd be surprised how many people are silently struggling with the exact same thing. Now, let me explain what's really happening. Most people believe the bladder is the main problem, but very often, the bladder is only the messenger. The real story begins much earlier. It begins with your kidneys, your hormones, your circulation, and surprisingly, gravity. Think of your body like a house with plumbing. During the daytime, everything flows differently because you're upright and moving around, but the moment you lie down at night, the entire plumbing system changes. And after age 60, those changes become much more dramatic. This is why someone can feel perfectly fine all day and suddenly start waking up repeatedly once they go to bed. Now, here's something fascinating. Your kidneys actually operate on a schedule. Most people don't know this. During the daytime, your kidneys are in full working mode, filtering rapidly, processing fluid efficiently, producing urine steadily. But at night, the body is supposed to shift gears. A hormone called vasopressin rises naturally while you sleep. Now don't let the medical term intimidate you. Think of vasopressin as your body's nighttime water-saving system. Its job is simple. Slow down urine production while you sleep. It tells the kidneys, "We're resting now. Don't overload the bladder tonight." That's the normal design. But here's the problem. If you drink large amounts of water late in the evening, especially in the 2 or 3 hours before bed, you overwhelm that system completely. Your kidneys keep producing urine, your bladder keeps filling, and your brain keeps waking you up. One major study found that adjusting evening fluid timing significantly reduced nighttime bathroom trips in older adults. Now think of it this way. Imagine trying to mop a floor while someone keeps pouring buckets of water onto it. That's what late-night drinking does to your bladder. Your body is trying to settle down for sleep, but fluid keeps arriving. And this becomes even more important after age 60, because vasopressin production naturally declines with age, meaning older adults become much more sensitive to evening fluids. In your 30 seconds, your body might tolerate 2 large glasses of water before bed without much trouble. At 75, that same amount can trigger 3 or 4 bathroom trips overnight, not because your body is broken, because biology changed. And once you understand that, you stop fighting your body and start working with it. I remember a patient named Helen. Helen was 72, wonderful woman, very health conscious. She drank water constantly because she believed more water was always healthier. She carried a large bottle everywhere, and every evening while watching television, she'd sip continuously right until bedtime. Then she'd wake up 4 times every night. She thought she had a bladder disease. But when we looked closely, her issue wasn't the total amount of water, it was the timing. We made one simple change. We moved most of her hydration earlier in the day and created a firm evening cutoff. 3 weeks later, she looked like a completely different person. She told me, "Dr. Caldwell, I forgot what uninterrupted sleep felt like." And this is where things become dangerous for many seniors, because poor sleep affects far more than energy. Repeated nighttime waking increases fall risk dramatically, especially in older adults. Think about what happens at 2 a.m. The room is dark, you're groggy, balance is weaker, blood pressure shifts suddenly when standing, and many older adults are already slightly dehydrated or on medications that affect balance. That combination becomes risky. Some of the most serious falls I've seen in older adults happen during nighttime bathroom trips. Broken hips, head injuries, hospitalizations, and sadly, sometimes the person never fully regains independence afterward. That's why this conversation matters so much. Now, let me tell you the first major hydration rule I teach almost every patient over 60. Front load your water. What does that mean? It means drinking most of your fluids earlier in the day instead of later. This is one of the most powerful habits for reducing nighttime urination naturally. Your kidneys process fluid more efficiently during the daytime when you're upright, active, and metabolically alert. That's when the body wants to handle larger fluid volumes. But most people do the opposite. They barely drink all morning. Maybe 1 cup of coffee. Very little water. Then afternoon arrives, and suddenly they start catching up. Water with dinner, tea after dinner, another glass while watching television. Then maybe medications with water before bed. And now the bladder is overloaded exactly when the body is trying to sleep. A clinical study found that older adults who consumed most of their fluids earlier in the day experienced major reductions in nighttime urination episodes. And honestly, this makes perfect biological sense. Your body wants rhythm, predictability, timing. The kidneys love routine. One patient named Frank completely transformed his sleep with this strategy. Frank was 69, retired mechanic. He woke up every 2 hours, every single night. He thought prostate problems were entirely to blame. And yes, he had some mild prostate enlargement. But when we tracked his drinking schedule, the pattern became obvious. He drank very little before noon, then overloaded himself in the evening. We shifted his hydration earlier, big glass of water after waking, steady intake through the morning, moderate intake with lunch, then tapering after 5 p.m. Within 1 month, Frank dropped from 4 nighttime bathroom trips to one. And he kept saying the same thing during follow-up visits. I can finally sleep deeply again. Now listen carefully because this next part matters. I'm not telling you to become dehydrated. That would be dangerous. Some people hear conversations like this and suddenly stop drinking enough water altogether. Please don't do that. Dehydration creates its own problems. Constipation, kidney stress, confusion, dizziness. Urinary infections. What we're talking about is smarter hydration, not less hydration. Timing matters just as much as quantity. Think of it this way. If you water a garden at noon, the soil absorbs it properly. If you flood the garden at midnight, water pools where it shouldn't. Your body works similarly. Now, there's another hidden issue almost nobody talks about. And honestly, this one surprises nearly every patient I explain it to. For many older adults, nighttime urination is not actually coming from the bladder alone. It's coming from the legs. Yes, the legs. Let me explain. Throughout the day, gravity pulls fluid downward into the tissues of your lower body, especially if you sit a lot, especially if you eat a high-salt diet, especially if circulation isn't as strong as it once was. That fluid quietly accumulates in the legs and ankles all day long. Sometimes you notice mild swelling, sometimes you don't, but then bedtime comes. You lie flat, gravity changes, and suddenly that pooled fluid re-enters the bloodstream. Your kidneys detect the extra fluid and begin turning it into urine. Now your bladder starts filling rapidly while you're trying to sleep. And this is where things become dangerous, because many people mistakenly think their bladder is malfunctioning when the real issue is fluid redistribution. A major study found that reducing sodium intake and improving daytime fluid movement significantly lowered nighttime urination frequency in older adults. This is one reason salt matters so much after age 60. Most people think salt only affects blood pressure, but salt also increases fluid retention. More retained fluid means more fluid shifting at night, and more nighttime urination. I once treated a patient named Dorothy. Dorothy was 76 and exhausted all the time because she was waking up 5 times nightly. 5. She had tried medications, bladder exercises, sleep aids, nothing worked. Then we reviewed her diet carefully. Canned soups, frozen meals, restaurant food, crackers, processed deli meats. Her sodium intake was extremely high. We gradually reduced her salt intake and added a simple afternoon leg elevation routine. Nothing extreme, just elevating her legs for about 30 minutes before dinner. Within weeks, her nighttime urination improved dramatically. And the emotional part I'll never forget? She cried during our follow-up visit, not because of the bathroom improvements themselves, but because she finally felt rested again. That's how deeply sleep affects quality of life. And honestly, many older adults have forgotten what real sleep even feels like. Now, let's talk about something else that silently worsens nighttime urination. Caffeine, especially late-day caffeine, coffee, tea, sodas, even some healthy energy drinks. Caffeine stimulates the bladder and increases urine production. But here's what many seniors don't realize. Aging slows caffeine metabolism, meaning caffeine stays in the body longer after 60. That afternoon coffee at 4 p.m., your body may still be processing it at 10 p.m. Alcohol creates similar problems. Many people think alcohol helps them sleep because it makes them sleepy initially. But biologically, alcohol disrupts deep sleep and increases nighttime urination. It suppresses vasopressin, meaning the kidneys produce more urine. So the person falls asleep quickly, but wakes up repeatedly later. That fragmented sleep becomes exhausting over time. Now, let me give you a simple nighttime hydration framework I often recommend. First, drink a full glass of water in the morning shortly after waking, before coffee if possible. Second, continue steady hydration through late morning and early afternoon. Third, begin tapering fluids after 5 p.m. Fourth, create a firm cutoff roughly 2 to 3 hours before bed. Not perfection, just consistency. And fifth, if you truly need fluid later in the evening, sip slowly instead of drinking large amounts at once. Small adjustments matter enormously. Now there's another emotional side to this conversation that people rarely discuss: embarrassment. Many older adults feel ashamed about nighttime urination, especially men. They quietly suffer. They stop traveling, avoid overnight visits, become anxious about sleeping away from home. Some even limit social activities because they're exhausted from poor sleep. But please hear me clearly. You are not failing. Your body is changing, and understanding those changes gives you power, not fear. Power. The goal is not perfection. The goal is improvement. Even reducing nighttime bathroom trips from 4 to 2 can dramatically improve sleep quality and energy. And better sleep changes everything. Mood improves, memory improves, balance improves. Energy improves. Even blood pressure often improves with better sleep. Everything in the body is connected. Now I want to talk briefly about medications, because many common medications affect nighttime urination, especially diuretics, sometimes called water pills. These medications intentionally increase urine production. And timing matters tremendously. Taking certain medications too late in the day can absolutely worsen nocturia. Now please listen carefully. Never change medications on your own. Never stop prescribed treatment without speaking to your doctor. But it's very reasonable to ask your physician whether medication timing could be contributing to nighttime symptoms. That conversation matters. And informed patients often get better outcomes because they ask thoughtful questions. Now, here's something hopeful. The body is remarkably adaptable. Even after years of disrupted sleep, many older adults improve significantly once they align hydration habits with their body's natural rhythms. That's the encouraging part. Your body wants balance. It wants rhythm. It wants consistency. Sometimes it simply needs the right timing. And what most people don't realize is that aging successfully often depends less on dramatic medical interventions and more on understanding how the body changes over time. That understanding becomes protective. Now, let's bring all of this together. If you remember nothing else from today's conversation, remember these 3 things. Number 1, drink most of your water earlier in the day. Your kidneys are designed to process fluids more efficiently while you're awake and active. Number 2, reduce evening fluid overload, especially in the final 2 to 3 hours before bed. That gives your bladder and kidneys time to settle down overnight. And number 3, pay attention to hidden fluid retention from excess sodium and prolonged sitting, because sometimes the bladder problem actually begins in the legs. Those 3 changes together can dramatically improve nighttime sleep for many older adults. And the beautiful part? None of them require expensive treatments. They simply work with your biology instead of against it. I want to leave you with this. Waking up constantly at night is not something you should automatically accept as just aging. Yes, the body changes with age, but many nighttime urination triggers are manageable once you understand what's truly happening. Better sleep is possible. More restful nights are possible. Feeling energetic again is possible. Sometimes the solution begins with something as simple as changing when and how you drink water. If this conversation helped you, leave a comment below saying, "Better sleep." I genuinely love reading your experiences. And if you know someone over 60 who wakes up constantly at night to use the bathroom, please share this video with them. It may help them more than you realize. And don't forget to subscribe, because next time, we're going to talk about the hidden evening habits that silently weaken bladder control after age 65. Until then, take care of yourself. Protect your sleep, be patient with your body, and remember, aging well is not about fighting your body. It's about finally learning how to work with it. I'm Dr. Caldwell, and I'll see you in the next video.